NCLEX RN Study Notes. Subject, Management of Care. Module. Chapter, Assignment, Delegation and Supervision.
The RN takes responsibility and accountability for the provision of nursing practice.
The RN directs care and determines the appropriate utilization of any assistant involved in providing direct patient care.
The RN may delegate components of care but does not delegate the nursing process itself. The practice pervasive functions of assessment, planning, evaluation and nursing judgment cannot be delegated.
The decision of whether or not to delegate or assign is based upon the RN's judgment concerning the condition of the patient, the competence of all members of the nursing team and the degree of supervision that will be required of the RN if a task is delegated.
The RN delegates only those tasks for which she or he believes the other healthcare worker has the knowledge and skill to perform, taking into consideration training, cultural competence, experience and facility/agency policies and procedures.
The RN individualizes communication regarding the delegation to the nursing assistive personnel and client situation, and the communication should be clear, concise, correct and complete. The RN verifies comprehension with the nursing assistive personnel and that the assistant accepts the delegation and the responsibility that accompanies it.
Communication must be a two-way process. Nursing assistive personnel should have the opportunity to ask questions and offer clarification of expectations.
The RN uses critical thinking and professional judgment when following the 5 rights of delegation, to be sure that the delegation or assignment is the right task, under the right circumstances, to the right person, with the right directions and communication, and under the right supervision and evaluation.
Chief nursing officers are accountable for establishing systems to assess, monitor, verify and communicate ongoing competence requirements in areas related to delegation.
The organization is accountable for delegation through the allocation of resources to ensure sufficient staffing so that the RN can delegate appropriately.
The organization is accountable for documenting competencies for all staff providing direct patient care and for ensuring that the RN has access to competency information for staff to whom the RN is delegating patient care.
Organizational policies on delegation are developed with the active participation of all nurses, staff, managers and administrators.
The organization ensures that the education needs of nursing assistive personnel are met through the implementation of a system that allows for nurse input.
Organizations have policies in place that allow input from nurses indicating that delegation is a professional right and responsibility.